All right, can everyone hear me okay?
Yes.
Great. Can folks see the slide deck?
Yeah.
Okay, wonderful. Well, welcome to November office hours, everyone. And we've got this session recorded as we normally do, and wanted to let folks know that this will be available as always once we get it up on the website. If folks have questions along the way, as usual, please pop them in the chat and ask along the way as you always can. Um, and we'll get going into today's agenda. We don't have a very long agenda today, but we do have stuff to talk about that wanted to make sure we had some time to talk through. So we'll get into it. We got still folks, a bunch of people joining, so bear with me as we get going. But quality and performance compliance updates. Got a lot to talk around plan of care, manual signature, capture process that's going to be coming forth through NetSmart. Some change with AOT member signature refusal that NetSmart has added. Data Den update as well, and then upcoming trainings that's going to be coming as well. And so with that, we'll jump into it. Touched on this last time. So basically, Department of Health had reached out, as I mentioned, last office hours, um, and touched base with us about a potential compliance concern for health homes using NetSmart around plans of care for adults and children, and talked about that with the compliance concern around plans of care. And they met with all health homes that use a NetSmart product, and in particular talked with AHI Health Home about that and wanted us to start to take a look at it from our particular lead, and would be following up with us further about that. In the meantime, they wanted us to reach out to our network, and we had done so after that immediately and asked for the network to start immediately to follow with signatures in sync with manual plans of care being in sync with the electronic signature finalized for submission for all plans of care moving forward. And that there would be more to come as we got more information. So that this slide should be familiar from our last office hours as a result of that. And we also asked that each care management agency to start taking a look at your internal organizations as far as records and start to take a look at it as well. Um, Now, we did get more information since then. We received a notification from the Department of Health November 13th, actually, coming up on 2 weeks. And they basically wrote in that notification that they felt all health homes that use NetSmart, ours in particular, as one of them, had a potential compliance concern around the plan of care as a result of their discussion around the process, and wanted us to start to do an audit as a result of that across our network, and to review all plans of care accordingly as a result of that for all manual signatures and electronic signatures going back as far as reasonable, and take a look at that. And we need to look at all signature dates in that process and ensure that we're meeting the standard for the 56-day requirement, um, and make sure that that's in alignment with policy. And in that process, we have to follow through and do a comprehensive audit. And we ultimately are going to be looking back to August of 23 when they implemented the um, upload to map from the plan of care when that initiated, which was in August of 23. So we have to go back to that timeline look at all plan of care that started to in that process from August of 23 forward to present, and look at plans of care from that timeline, any amendments from that timeline as well. And we have to report the results of that audit. That audit has to be done in a reasonable time frame. I just recently today submitted our first response to the Department of Health because we had to, within 2 weeks of receiving this notification on the 13th, respond to them on our workflow process based on their discussion with us from the memorandum that we received on the 13th, on what our workflow was, what the gap was from what they felt the NetSmart workflow was on manual signatures, and what we had as a process in our network, what we thought the gap was potentially, what we were expecting to do moving forward, and then obviously have to audit our network, and then the results of that audit, and then we have to also, and this is all leads that use the NetSmart product has to do an audit of their networks. We're also expected to return, report, and explain any overpayments that would be potential disclosures to the self-disclosure process through OMEG. So that's the expectation that the Department of Health has put forward for the lead health homes at this juncture. So I wanted to share that with the network, that is the expectation that's been put out to the lead health homes at this point. We've just started our audit. We're just starting the review process. At this juncture, it's thousands of records. Obviously, they have to be reviewed. They're going to have to be reviewed manually. It's going to be an extensive review. Reasonable expectation is that it's going to take some time to do that. But as far as the 56-day requirement, we need to ensure that that is being met, and that the plans of care are uploaded in the record in that 56-day timeline moving forward, and that those signatures are obtained. So I just want to pause at the moment and just offer opportunity for folks to respond. I just said a lot. And Jessica, I didn't know if you had anything you wanted to add at this point before folks had any comments or any questions before we go further.
No, I don't have anything to add, but we do have a question. It says, in terms of the audits, what does this mean, or what will be required from individual CMAs?
As far as the audits themselves, I would say you would want to review your records within your organization. We're going to be reviewing all the records as a lead. If there's missing documentation, missing signatures, missing plans, clearly if you're billing for services and there's missing plans and missing signatures, that's not allowable. I mean, that can't happen, and that would be something that would have to be disclosed as a self-disclosure. I would say that. I would be reviewing to see what you have in your files, to see if you have plans that are possibly not uploaded, that you have in place in your files that may have not been uploaded, that you would have that have been completed, that may possibly not have been uploaded. Doing that type of a review to see what that you have on record that possibly just may not have gotten uploaded. There would be a time, date, and stamp that NetSmart would show that it was uploaded late, but at least you've got it in the file. And then, as a lead, we'd have to look at it at that point and have to make determinations as a lead and have discussions with, our attorneys and all that type of stuff. But at least it's in the record at that point, and it's there, and it's showing that the member may have signed it within the 56-day requirement timeline. It was just uploaded in the record late, in that regard. But if it was never signed, if it was never done, that's a whole nother issue. I hope that helps answer the question. I would start doing a review in that sense to see what you have, what's not there, trying to understand what your organization's scenario is. We're going to be doing a review. We have to do the review as a lead, clearly. Is that helpful?
Yes, Travis, it was. Thank you.
Yes, sir.
Any other questions, thoughts? I mean, this is not ideal, obviously.
We did have another question come in. Anna's asking if there's a review tool that could be shared to help isolate the review.
Not one that we've developed in that sense. I mean, we have something that we've created for our purposes on a lead level. For network purposes, we haven't created one on a CMA level, though. I think we'd probably have to put some thought behind that. We could take a look at that and get back to you on that for sure, though. I mean, I'm not going to say we wouldn't definitely look at that for you. Yeah, we meet tomorrow morning. We can talk about that, Jess, definitely for them. See what we can come up with. Any other questions? The second part of this, I mean, the reasonable timeline is not defined. I mean, I think the Department of Health obviously wants this review done, the audit done sooner than later. So we're going to be pushing through this in the coming weeks and then have to report back on that. The second piece of this on top of that is NetSmart and the other lead health homes that are using the NetSmart product that were impacted by this have met twice, and November 6th and then again on November 21st. And the Department of Health actually was part of the November 21st meeting, as well as the executive director for the Health Home Coalition, and went over what is going to be the proposed plan of care manual signature capture component that's going to go into the system, but it's not going to be rolled out until the first quarter of 26, which I'm not too crazy about, and I don't believe others are either, but that is the proposed timeline for this. But I'm going to show you on the next few slides what that's going to look like, but it's going to be an attachment that'll get rolled up and tie in the map once it's finalized, so that it'll be another thing to help be a surefire thing, if you will, and NetSmart to help minimize the risk here in a sense. So when you're working with someone, you do a manual upload of the plan of care. You've got this new attachment tab that you go to work with the person. You go in, you push the tab, obviously, and it allows you to start to do that upload. And it'll have the dialogue to do that. So it's got this step process for that for you as the person working in there. And then it starts to walk you through that process. And then you'll have the upload box come in as you normally would when you start to do an upload for an attachment. And it just walks you through that process. And through its completion, and then it uploads into the documents tab. And then it does a time, date, and stamp, just like you would when you finalize, as you would anything else in the system once it's done. So that's what's going to happen once it's up and running. But again, it's not going to happen until the first quarter of 26. The feedback that Department of Health did give, they didn't put a formal stamp of approval on it, but as they were on the call, they did say it seems or sounds as though that NetSmart was on the right track with this, and it looked as though it was going to meet what looked like it was, we're going to be the needs to close the loop on this area. But then again, they weren't coming out and saying that it was fixing it. So, but they were there, and overall saying that it was looking like it was capturing the need. So, but we're going to continue as the leads working with NetSmart to ensure that this gets followed through on, and then other things as well to ensure that this area gets tightened up and other things moving forward. Any questions on what I just went through with the NetSmart piece?
We did have one that came through the chat that I did answer. The question was, will the wet ink signature have to be collected the same day as the plan of care is typed? I said that you're going to complete the plan of care. Then if you have to collect a wet ink signature, you're going to go do that. Come back to the plan of care section and attach your signed POC directly into the plan of care section where you will populate the date that you're doing that. And then that date will become your finalized date. So it's not too terribly different from our current process. It's just you're now attaching it directly into the POC section and putting a date in. Then we did get a second question just now from Jessica Casey saying, are they going to be looking at taking back payments for inconsistencies? Apologies if I missed that.
I think there's going to be, if it's, I think that question, Jessica, is one that is going to get looked at from the health home. The Department of Health is saying if it's a gross difference in that 56-day time frame and misalignment from when that finalization date for the electronic upload to map from the manual signature date, if they're vastly different, they have an issue with that. I think through our audit process, I think the lead is definitely going to look at that, and if it's close, if they're close dates, I think we're definitely going to advocate strongly to advocate on behalf of the network and the care management agencies. If it's vastly different, I think we're going to have a hard time because of the policy and what's in place, but if they're close, we're gonna do our best to advocate strongly. I don't know how to answer it any other way. Is that helpful?
Jessica says yes. Also, another question came in asking, are payments going to be taken back if there is documentation of attempts to have a plan of care signed?
I think that's another area where the lead's gonna advocate strongly if there's clear efforts that have been put in place to show that there's been efforts and attempts and there's been documentation put in place to show that that's been there. I think also, you know, we as a lead have legal looking at things as well and are going to advocate where we can in that area if we feel we have a basis to do so, but where it's grossly out of whack, we're not going to be able to do so because of the OMIG standards. So there's only so far we're going to be able to bend because of that. But where we can, we're going to do what we can. There's gonna end up being take backs through this process. I'm not gonna say there's not. How much and how far it's gonna go, I don't know. It's gonna depend on what we find through the process and how, you know, where there's no signatures and there's no plans in place, we're not gonna be able to fight that. That's facts. Those are gonna be take backs. The discrepancies and how far the dates are out of whack, that's gonna come down to how far it's apart and how we can advocate and how strongly we can advocate. The signatures and the documentation piece, you know, I think those are gonna be gray areas that are gonna have to get looked at real close and the substance behind each one of those are all gonna be circumstantial discussions. And I don't have a black and white answer on those, unfortunately. Those are gonna be circumstances that will have to get looked at individually. I hope that's helpful. I don't know any other way to answer those clearly for folks, unfortunately.
We have another question that comes in saying, if I complete a plan of care with a member on Monday afternoon, but I don't upload a wet signature until after Tuesday morning, is that okay? So POC is completed on Monday, wet ink signature is on Tuesday.
Monday, Tuesday, I don't know, we're splitting hairs now. I guess it's reasonable, I would imagine. What do you think, Jessica? That sounds reasonable. It's within a reasonable time frame.
So in future state, what will happen is that if you have a plan of care that you needed to complete on Monday, you completed it Monday, Tuesday, you got the signature. Under the new way, you would go back into the plan of care section, you would type in the date that you got the signature and upload it. And then that date that you uploaded the signed plan of care now is this plan of care finalized date. So it's no longer going to be when you click that little button at the top. It's now going to be when you put that date in there, unless you're using electronic signatures, which is always preferred. So that would be okay. The only kind of caveat to that where something would be non-billable would be if your plan of care was already overdue and you completed it on Monday, but they did not sign it until Tuesday, what you did on Monday is non-billable because technically they do not have a signed active plan of care. So that those tiny nuances that you just have to keep in mind when you go through your workflow. But future state, the system will now catch the fact that if you try to bill for Monday, that that's non.
Oh, did we lose someone? Jessica? Can folks hear me?
I can hear you. Can anyone hear me?
I can hear you.
Yep.
Yes.
Yes.
We can hear you.
All right. We lost
Yeah, so
somebody for a second there.
So future state, the system will catch that Monday was non-billable. The issue is right now is this, there is no kind of checks and balances in place. So right now that date's just going up to MAP. So to answer your question, yes, but it is dependent on when that plan of care due date is.
Any other questions on this?
We have a comment. It says, it sounds like the moral of the story is the plan of care is not final or billable until signature is documented. Does that sound correct? That is correct.
Yes.
And then someone is saying to clarify, we do not yet have a date of when the update will take place in NetSmart. That is also correct. We do
That's
not have
correct.
a date.
That's correct. They're saying first quarter of 26, and it's not solid at this point. Okay, so anything else on this, please reach out. We're going to start digging. We already did start the audit. And you know, this includes, we're doing our internal CMA as well. I mean, this is everybody going through this, the other leads that use NetSmart as well, as I've mentioned. And go through it and move forward. We're going to be updating our policy as well. And getting that updated and out for each the children's and the adult policy. They're coming due in January anyway, so they would have been updated. They're due for updates anyhow. So, and just do the updates and move forward. And we'll meet tomorrow. We have a meeting tomorrow. We'll talk about any format we can get out to folks for review on year end, and get that out to folks. The other thing that NetSmart did come up with too is a plan of care changes for members that are AOT, for AOT members that want to refuse signing their plan of care. So they now have a refusal signature capability within Care Manager. So there's a little box that can be clicked now for them to refuse signing off on for the client signature. So that's now something that's going to be available for folks that are AOT. So just so folks are aware, if it's selected, they can go in and they can refuse to sign. You can click that, and it says client refused to sign. Next thing, data den. Everybody's well aware it's down, and it's going to be down likely through the remainder of this year. Sincerely sorry about that. We're missing it dearly. NetSmart is still in between their server updates. They pushed it out again until the middle of December. It was supposed to happen in the beginning of October, then the middle of October, then they pushed it out again. They're still not fully over to their new server update on their end. Our last full refresh in Data Den was October 17th, which was a Friday. It's put our quality notebooks on hold because a lot of the data was coming out through Data Den for that. And ultimately what's been happening is our data analyst at HI has been rebuilding and realigning tables through our Power BI platform to try and align with the new server that they've been moving over to through NetSmart, and that's what's been taking time to redo. Our hope is that we can get that as they switch it over by, they're saying the middle of December, by year end, get it so that we wouldn't have all reports and data done up, but get some key reports back up and running by year end is our goal for folks. So that's the status. We're sincerely sorry about this. We know it's a valuable tool for the network, and we really look forward to getting it back up and going for folks. But that is the update at the moment.
Before
Upcoming,
oh,
yes.
we just had a few comments. Someone questioned about the AOT feature. Will that feature only appear for AOT members? Yes, they have to have that AOT program entered into NetSmart, and then that will appear. Someone said, it's my understanding that you can still bill for a core service that was done prior before the due date of a comp, plan of care, or CES tool. Yes, that's still correct. As long as they are current and active, you can still bill. And then Paul asked about the third signature place, the third signature spot on a child's plan of care. I'm not sure if that was discussed on that Friday call or not. I wasn't on that call, Travis. If not, I was going to reach back out to NetSmart to see if it was still on their radar.
It wasn't talked through.
Okay, so I'll email NetSmart separately just to make sure that's on the radar. And then someone's just clarifying if the care plan is overdue, it would not be billable. That's correct. So anytime you're overdue for your care plan or overdue for a CES tool, everything you do once you hit that overdue date is non-billable until those items are completed.
Thank you, Jessica.
Mm-hmm.
And then the last thing we had on today's agenda was just upcoming training. Jessica's putting together a care transitions training for the first quarter of 26. Just so folks are aware that that's something that's going to be coming along. And then that was it. Oh, and then just wanted to mention too, tomorrow, didn't put it in the slide deck, but tomorrow we have our exit for our children's redesignation for our lead health home. So we'll hear some feedback. It may not be fully finalized, but that is our exit meeting anyways, for our children's redesignation for the lead. So that will be tomorrow. But wanted to open it up for any other discussion or questions or comments that anybody might have for us.
Travis, just one. It's Paul. How are you?
Hi.
So I just popped it in the chat too, but I think related to the children's plan of care, what I'm finding in our reviews is that we have many that have been signed by the client and by the care manager, but the client's under 18 and not the consenter, which I'm assuming if one were to ask the Department of Health, they may not consider that signed. Does that sound correct?
Well, well, I don't know, depending on how the policy reads, Jessica, if the child's 10 or older, they have the ability to consent on some level, correct?
Yes, I think that we have not directly asked the Department of Health for their clarification around that component of signature and whether that is considered a finalized plan of care. I believe that the argument can be made if at least one of those signatures is in place, then that plan of care is valid, even if they are not self-consenting. But that is something that we have to bring back to the Department of Health to get clarification on because there is nothing clearly written in policy on that, other than
Yeah.
we're supposed to have it if they're above 10. But they're allowed to refuse, but the medical consenter is not allowed to refuse.
Right,
Right, right. And our problem becomes there's no signature from the consenter at all. It's
right.
the child and the care manager. So maybe an 8-year-old and the care manager.
Yeah, I
So
definitely think.
maybe you shouldn't ask that question to them specifically because I might not want to know the answer.
Right.
Yeah, I think there
I
could
think,
be a lot of advocacy around the fact that we do have a signature from the enrolled member. Um,
I think we might be all right to advocate if they're 10 and, I mean, especially if they're 10 and older, we, we, we have enough because you have a level of consent at that point, at least,
Right.
to argue,
For
argue the
certain.
point, argue the point at least that you have a capacity to make a decision to some level.
Well,
Um,
perfect. If I can help in the argument, please let me know.
yeah. Um, like I said, I think as a lead, our role is going to be to advocate as strongly as we can where we can. I mean, that's part of our function, right? And we're going to do that wherever we can, but there's also going to be points where we're not going to OMIG is going to have there's going to be a piece where the standards are there where we're just not going to have the flexibility, but wherever we can, we're going to, so but I just think if there's consenting ability and the signatures there, we're going to advocate. I think there's room there. Now, if they're 5, that might be a different story. That would be a tough one. That's a good question. Any other questions?
I guess my one follow-up question, Travis, is moving forward, should the consenter be signing in the child blank? And if so, where does the child sign?
Well, if the consenter is the one that should be signing, if the child's not able to consent, if we're talking in that regard, then it's the consenter who's signing.
Right. I don't disagree. I just don't think there's an avenue for both. So if it comes
Right.
time when we've got to choose one or the other, is your advice that we choose the consenter or that we choose the client? Or that we just forego the signature of the care manager and have the consenter sign in the care manager blank? Like the setup of the system
Well,
is
you have to have
not
the care manager has to sign, and then the care manager and the consenter, I would say, would be the ones to sign if you're going to safeguard yourself. If we're talking about the best way to go, but in this situation that you just brought up, you had someone under 18 sign it, and that's the circumstance currently for the example you brought up.
Right,
And
right, right.
can
Yeah, I
we
just think what I'm
advocate,
trying to
can
do
we
is justify the
advocate in
probable.
this, right, but can we advocate in this situation in your example? I would say based on your example, we can try to do that based on how
So
policy is written.
I'll just jump in here. So right now, yes, we only have those two signature boxes. The care manager does have to sign the plan of care. So that box has to be utilized for care manager signature. If you are collecting an electronic signature, I would say for the time being, the medical consenter's signature will trump the member's signature if they are not self-consenting under 18. What we do internally is if we're getting an electronic signature, we will try to have whomever do both signatures in that one box. So you will see a medical consenter signature and then a kid signature in there. The other thing that we do is if we're doing a wet ink signature, we will just draw another line or have another space on the plan of care somewhere in there, not necessarily in that box, for then that youth to sign or to have the consenter sign. So as long as it's somewhere on there, that is okay.
Gotcha. Thank you.
Yep. And then the conversation on the chat just says, is there a way to get another signature line for the caregiver? And that's coming from Brooke. Yes, that's what we're advocating for. We're advocating for Children's Plan of Care is actually to have 3 boxes: care manager, enrolled member, and then medical consenter if necessary. Then someone else states the child is the member and signs on the member line. Sometimes I draw a line for the parent to sign. That's totally appropriate as long as we see those 3 signatures. Um, then Marcus just typed in, he said, will this change affect amendments as far as timing on signatures afterwards? Also, I was listening to a past presentation and I thought you mentioned we should, sorry, that we should be available 24 hours, just trying to get the clarification. So I think he means, will this change affect amendments as far as timing of signatures? Also, I thought I heard it was 24 hours on a previous presentation. Did you want to take that, Travis?
I'm not sure what he means by 24 hours.
I think he's under the impression that he had 24 hours to get a signature. Yeah, so once you get that signature, Marcus, that is when that plan of care is considered final and complete. So for currently, you don't want to finalize it until you have that wet ink signature. Future state, you'll be able to kind of finalize the plan of care, print it off, come back, upload it, input the date that you got that signature, and then it will be finalized. 24 hours between the time it's completed to the time of signature is a reasonable time frame.
Oh, I didn't know what he meant. I didn't know what he meant by 24 hours, Marcus. I'm sorry.
I think that's what he meant.
Oh.
He's saying no. Oh, no, I'm asking if as a care manager, we're supposed to be available for 24 hours. Are you talking about the access to care policy? Because that is different than the plan of care. Or are those two questions combined all into one bucket? Can you unmute yourself? I just want to make sure I'm answering your question.
Hello, can you hear me?
Yes.
All right, I'm sorry. Yeah, so I was just asking if, as a care manager, if a member would, if we're supposed to be available 24 hours for them.
Okay, so you're talking about the access to care policy. So, what that means is that an enrolled member needs to have access to some sort of 24/7 available number. That does not mean that you as a care manager have to be available 24/7. So each CMA kind of sets that up differently, and each CMA has a different on-call structure. So some larger CMAs that have like a 1-800 line, a crisis line, they will defer members to that line. Internally, our CMA, we have team leads. They tend to be on call. And if something were to come in, they kind of screen the situation, see if it is an emergency and they need to contact that person back, or if it's something that can wait till the next business day. So it is different for each CMA. And I'm not sure how your CMA has that set up or is looking to get that set up.
Is that helpful, Marcus?
We can
Yes,
we can talk
thank
about
you.
that at your next call too, Marcus. We can talk about that with your team.
Sounds good. Thank you.
Mm-hmm.
Any other questions or anything anybody else want to talk about? I do want to let folks know we don't currently have another office hour scheduled for this year. We may, but at the moment we don't. Generally don't have one in December. But last year we did, I think. We had a special office hours going. But anyhow, at the moment we don't have one scheduled. But as always, I just wanted to take some time to thank you all for everything that you do each and every day. Appreciate everything that you all do. I also want to wish you all a very happy Thanksgiving. And I hope you have a very safe holiday and have some time off and enjoy your loved ones and family and friends. And just want to thank you all. So take care, everybody.
I have a quick question. I'm sorry.
Yes.
So it's just about the billing policy. I'm understanding that as long as the core service is done before anything is overdue, that's good. But let's say the comp or the care plan isn't completed within that month. Like let's say it was due this month, November, and we go to do November billing, and the core service was done and billed for before anything was due, but now we're in December and things are still overdue. Is that going to cause problems with November billing? Does that make sense?
So the core services, you have to say it again. Core
Yeah, no,
service.
no problem. So let's say we're doing November billing and a
Yeah.
core service was done before anything was overdue.
Okay.
So we can bill because nothing is overdue yet, technically.
Yes.
But let's say now we're in December and those things are now overdue, which were due in November. Is that going to cause problems for November billing because it was in that month? Like it wasn't completed within the month cycle? Or is it only just until it's done, then we can bill in December, or we won't be able to bill until those are done? Does that make more sense?
I think what she's saying is, say care plans due November 20th. We complete a core service November 10th, so we're still in that active care plan, but then we bill for November and the care plan is now out of due.
Exactly. And now we're on the next month, we're in December, and that's still overdue. Is that going to cause any problems for the billing that was in the previous month where the care plan was due? But we billed because it wasn't overdue yet. But I'm thinking because the billing cycle is based off of each month, I just didn't know if that care plan wasn't done in that isolated month that it was due, can there ever possibly be a take back if we're on to the next month and we billed the month that it was due, but it wasn't done in that month. It was done the next month.
It should be
I'll-
fine.
Can
It
I
should be
jump in
fine
here?
as, yep, okay, go ahead.
Yes, you are That is correct. Anything that, so when you fill out your HMLs, you have to put the date of your billable service on those.
Yeah.
So don't just pick any date, and I guess this is something to bring back to everybody. You don't want to just pick any day in that month. For your instance of November, let's say that you had a billable service on the 10th, the plan of care was due the 25th or the 20th, and then you did a service on the 25th. If you did your HML for November and you put your billable service as 11/25, you are now non-billable because you delivered a
Right.
core service when your POC was overdue. If you delivered that core service on the 10th and when you filled out your HML, you put the 10th as your billable core service date, now you can bill for November. So as long as your core service is delivered before the item is overdue, so that overdue item is going to be a plan of care, assess tool, or an eligibility screen, then you are good to go. As far as billing goes, it would just be then anything after that date that you do is non-billable until whatever overdue item is completed.
Okay, that answers my question. Thank you.
Mhm.
Thank you, Jessica. Any other questions?
Hi, this is Mary. So I have a question, because I have in writing something different, with that directive. So I have, if we provided a core service on, and I'm making this up, November 10th, and the care plan was due November 20th, but it didn't get done on the 20th. It didn't get done for the entire month of November. It didn't get done, I don't know, till December 4th. I was told that even though a core service was provided before that POC amendment was due, but it was not done within the month it was due, that we could not bill. And I have the email, so I could forward it. So I'm confused as well about that directive. So
as long as I would have to see that email, Mary. So if you want to forward that back to us,
yes, I
if
will.
you have something that is due, let's just use today's date. Let's use the month of November. Today is the 25th. Let's say that my plan of care is due today. I have to have a updated, amended, signed plan of care. Today is the 25th. I had an in-person with my member on the 10th of November. I didn't update the plan of care on the 10th, but I had an in-person, I had a core service. When I go to do my HML for November, I am going to put the 10th as my core service date, and then that makes November billable. Now I can't bill for anything in December because now my plan of care is overdue. So I cannot bill for anything in December until that POC is finalized and signed. So let's say on December 2nd, I see my member again, or I call that member. We do a plan of care over the phone. It's not signed. I see them on the 5th, they sign it. Now I can bill for the 5th, but I cannot bill for that earlier date because that plan of care wasn't signed. So anything you do up until something is overdue and after something is completed and finalized is billable. It's that in between period where those are non-billable service dates. Does that make sense, or am I confusing people more?
That helped me. Thank you.
Yes, please send me that email, Mary. I'll take a peek at that. We did have another question that came in, and it said, I had it where I was not able to bill because the cans was late, but it was done within the month it was due, and I had another core service ahead of time. Okay, so the cans, Allison is asking this question. That works a little bit differently because once your cans is overdue, it does kind of block out the whole month. Once you do it and all of the systems catch up, then anything you do, let's say it's that third month, anything you do after that cans is completed is billable. So in that instance, it should have been billable. If there was an issue with that or billing got rejected, please reach out to the health home because we can rebill that out. So the cans does work a little bit differently, but there are some leniences there, and sometimes we just have to rebill something out. So when sometimes something is rejected, we would then rebill it out and you would be able to receive payment. The other thing with the cans and why that can be a little bit off is you always want to remind yourself that it takes 24 hours for MAP and the UAS to catch up to something. So if you did something in the UAS, you have to wait at least 24 hours for MAP to catch up. So that would be like 24 hours before MAP realized that that month is now billable going forward. So the cans can get a little bit tricky. And if you ever have a rejection for something, reach back out to us because we can re-push that through as long as we're notified in a timely fashion because it is time limited as far as rebilling goes.
Thank you, Jessica.
Mhm.
Any other questions? All right. Well, thank you all. Thanks again, everyone. Take care.